like him already. All right, so before anything else, before I welcome everybody, but I want Dr. Bhatia, our Chief Medical Officer, to pop the champagne, aka cider.
Doc.
We have Mike Sarian here because I can't say wine, right? All right, so he's popping the champagne.
We should do a cheers for
Cheers!
Oh, doesn't anybody else get
They all have.
All right, cheers everyone.
Cheers.
Cheers everyone. Thank you.
I should have shaken.
All right. So, welcome everyone. Today is a very special day for really Shermanoaks Hospital and Shermanoaks community of Shermanoaks, because we added another service, a very important service line for Shermanoaks Hospital. I know our speakers are going to be speaking about the importance of this service line and how vital it is to the community. And I know today is Friday the 13th. For the most part, I know Friday the 13th is a lucky day. So we must remember today, Friday the 13th, as a lucky day. So there will be a lot of thank you throughout all the speeches. I can't be doing all of the thank yous right now. But before anything else, of course, I would like to thank the executive team who really made this thing possible. And they will be mentioned throughout the speeches. But I want to recognize the folks who are in the back, who are really the Cath Lab folks, Cath Lab nurses, because they made this possible. I'd say this is almost a two-year-long journey, but it's well worth it, and really thankful for all the blessings today. So again, welcome guys. The order of the program will be, there will be a few speeches. It's going to be short, I promise guys. And then there will be a ribbon cutting right after the ceremony or the program, and we'll do it in the Cath Lab. And then we'll have some short tours of the Cath Lab for anyone who's interested in looking at the Cath Lab. Okay? So without further ado, first I'd like to call on Hilda Avenisian, who will say a few words about our dignitaries today, because I can't name all of them. She has the long list of dignitaries today, and I really, really appreciate your presence today.
Thank you, Roland. Thank you, everyone, again for attending today. It is such an honor to have been here such a short period of time, and when I send the invite out to everybody, not one of you hesitated to say yes automatically. So it is such an honor, and I got choked up. Oh my, I never get choked up. So it is such an honor to be here. Thank you for all your help and for all your support. It was such an honor planning this event, and thank you to Dr. M. Garcia and to Roland for just throwing the baton to me and saying, here, run with it, and not saying no to me. So I appreciate it. So thank you. But without further ado, we would like to invite some of our dignitaries and our VIPs. All of you are VIPs, but some of our dignitaries within our community are here. The first one is Congressman Brad Sherman's office, Ms. Mary Chakarian.
Thank you, Hilda, and thank you, Roland, for having us here today. My name is Mary Chakarian, and I'm here on behalf of Congressman Brad Sherman of the 30th Congressional District. Our office is actually located right across the street, so if you guys would ever need anything from me, you've got a friend in that office. But it's an honor to be here to celebrate the ribbon cutting for the Cardiac Cath Lab. I know that Congressman Sherman wanted to be here, but couldn't. But it's an honor to stand before the Encino Chamber, folks from this hospital, Mike Sarian, LAPD. Again, thank you so much for having us. With that being said, I'd like to present a certificate of congressional recognition to the Shermanoaks Hospital in honor of the opening. So, thank you so much.
Thank you.
Nice. One, two, three. One, two, three. Thank you.
Thank you.
Thank you, thank you.
Thank you. We do have the representatives of Shermanoaks Chamber of Commerce. We have Chairman of the Board, Tammy Scher, and the CEO, David Phelps. We would also like to thank Encino Chamber of Commerce, 2 days in a row, back to back. They've been there for us, supporting us. President Carrie Purcell and CEO Diana Duenas. If you can please come up.
I do want to thank everyone for having us, and Hilda, you've been fantastic, so congratulations all of you on this wonderful opening. We're so happy to be a part of it. We want to congratulate you and give you a certificate for the Shermanoaks Hospital Cardiac Cath Lab with your grand opening date on there, so we truly appreciate it. I'll give that to you, okay? Go ahead.
Hello everyone, I am Diana Duenas. Yes. Okay, I have certificates for you from State Senator Bob Hertzberg's office and also from, thank you, City Council Member David Rue's office. So congratulations and let's go.
Each one get one.
We'll let each one of you hold one.
He wants that perfect.
Okay. Get a little bit closer. Get closer.
I can stand in the
Now
back.
you're graduated.
No.
Ready? 1, 2, 3. 1, 2, 3. 1, 2. Thank you.
Thank you.
It is also a pleasure and an honor, representative of the Assembly Member, Adrian Nazarian, Miss Emma Taylor.
Thank you so much. The Assembly member is up in Sacramento. It's the last day to pass bills, so he's very sorry that he could not be here today, but I'm here with a certificate of recognition. We're very excited to see the Cardiac Cath Lab here in Shermanoaks. It's really a huge accomplishment, and so we're so glad to be celebrating with you guys today. Thank you so much.
Dignitary. Keep your eyes. Ready? 1, 2, 3. 1, 2, 3. 1, 2. Thank you.
Thank you.
And unfortunately, Ms. Tanaz Gulshan was not able to attend today. She was there yesterday at the Encino Farmers Market, but she is sending a certificate and her gratitude from Mayor Garcetti's office. So she will be sending a certificate to you guys. And without further ado, I would like to introduce Dr. M. Garcia for the next part of our program. Thank you.
Well, good afternoon. I'm pretty sure everybody's full and ready to go to bed. But I just wanted to actually give a shout out to our prime healthcare leadership. They're at the back. Tina, Debbie, some of our corporate directors are there. Thank you very, very much for your support. And our team here at Shermanoaks Hospital and Encino Hospital Medical Center, who have joined forces together to make this day a very momentous event. So without anything further, I would like to introduce our first speaker, Dr. Sunny Bhatia. And Dr. Bhatia is an interventional cardiologist in the San Fernando Valley, who is a quadruple board certified in internal medicine, cardiovascular disease, nuclear cardiology, and interventional cardiology. He dedicated his life to serving the needs of his patients with a focus in the evaluation and management of chest pain, coronary artery disease, congestive heart failure, hypertension, valvular heart disease in women and men, and maintaining cardiovascular wellness. So without anything further, I'd like to introduce to you to our Chief Medical Officer for both Shermanoaks Hospital and Encino Hospital Medical Center, and our Division 1 Chief Medical Officer for all of Prime Healthcare Services. Please give your welcome to Dr. Sunny Bhatia.
Thank you. Very, very kind. No, on behalf of Prime Healthcare Services, the foundation, our nonprofit arm, Shermanoaks Hospital, I welcome all of you to this event. All of you taking your time out of your busy days to celebrate with us does mean a lot. Personally, this means a lot to me. I started in this community about 9 years ago, and I was asked as an interventional cardiologist, why do I want to come to Shermanoaks? They have no cath lab. In fact, Dr. Reddy, our chair and CEO, said, Sonny, are you sure you want to do that? And I said, no, I do, because this community needs this, and it's such a good opportunity. And to see it actually come to light, we kind of joked how long it took, but we're here, and that dream became a reality today. So, but to get to that point, it took a lot of hard work from a lot of people. The leadership team here has been amazing. The cath lab team that has really come together in a great way in this past year has been amazing. I've worked closely with Dr. Rubin for many years, and really the gentleman right next to me, Dr. Koshkarian, who joined our group about a few years ago, has been a real asset to the group, to this hospital, to me personally. I feel like the practice is in good hands with him there, and I think we have an amazing opportunity now to do more. Shermanoaks has really been amazing in terms of its performance. As a nonprofit foundation hospital, it's been able to stay alive, stay relevant, and growing in a time where hospitals close. You're seeing a lot of issues with access to care, reduction of service lines. Here we're growing our service lines, and that's a testament to the hard work of everybody affiliated or involved with our organization. And it does take a village when the healthcare market is very challenging. So, we have these awards. I was just, every time I see it, it brings joy. A top 100 top hospital in 16, 17, 18. Leapfrog A. To get an A rating in this with these dynamics is very hard. And our competitors, some of them have Fs, some of them have Ds and Cs. To have an A rating goes a long way, and that's safety, that's quality, that's efficiency, that's financial solvency. So I think we've been able to do quite a bit, but most importantly, it's all, as a clinician and in healthcare, you want to give back, you want to make a difference, you want to be able to have our patients get the care that they need, and we've been always doing that, but now we can do more. Our ERs never close. I know we have some first responders here, and we appreciate all that you do, but our ERs never close. We have basically no wall time, no diversion time. Now we can add more to that. And this is very synergistic with what we do in this hospital. We take care of typically elderly patients with complex medical problems, whether it be stroke, whether it be wound care, whether it be infection. Now cardiac program will be expanded here, so we can take more comprehensive care of those patients with Dr. Koshkarian, Dr. Rubin, myself, our cardiac team, along with everybody else, our nurses and staff and the cath lab team. But it's a really special day for me personally. I know it means a lot to the hospital and all the staff members and so forth, but again, it's all about the patients, their families, the community, and to be able to do more for them is very special. It means a lot. So once again, thank you, and we look forward to what lies ahead.
Thank you, Dr. Bhatia. Now we have the man of the hour. Our medical director for our cardiac catheterization laboratory. It's Dr. Vahan Koshkarian, who is a top-ranked interventional cardiologist, providing men and women in the San Fernando Valley with the most advanced diagnostic and treatment options to help them enjoy better cardiovascular health and at every age. He's dedicated to offering individualized, patient-centered care that is focused on the unique needs of every single patient, with commitment to providing patients with the critical information that need to make informed and educated decisions about their care. The heart heartthrob of San Fernando Valley. Let me introduce to you. And I know the wife is right here, so you know. Sorry, I'm sorry. So you know, Dr. Ban Kashkarian.
I had to write my speech. I'm not as Dr. Bhatia, so good afternoon. Excuse me. Shermanoaks Hospital has really been near and dear to me for many years. Having been raised just a few blocks from here in Van Nuys, my family and I have been very familiar with this hospital even before I started here. So when I was given the opportunity to work in this hospital, I felt that it was my chance to give back. When Dr. Bhatia hired me to join his group 3 years ago, we had a vision for this hospital and its cardiology program. Interventional cardiology is a passion for us both, as Dr. Bhatia mentioned, and having a cardiac catheterization lab at Shermanoaks was our ultimate goal. After much hard work and dedication, this goal has finally come to fruition. The words heart attack have a very different meaning to us as cardiologists compared with the general public. To us, the meaning ranges from something as benign as, I wouldn't worry about it, to, we have to take you to the cath lab immediately. To our patients and their loved ones, the words evoke just one emotion, fear. To complicate matters, we are often forced to tell them that we have to transfer them to a different hospital as we are not equipped to fully care for them. As you can imagine, this sometimes leaves patients wondering why the paramedics brought them to our hospital or why they themselves made the effort to come. With the opening of our fully functional cardiac cath lab, this will no longer be the case. Patients can be reassured that we are capable of caring for them in their time of need. For that, we should be proud as healthcare professionals of all levels and as a hospital. Our community stands to benefit greatly from this. I am truly proud to be part of this endeavor, and I am honored to be the director of the Cardiac Catheterization Lab. However, I'm only a small part of the large team that made this possible. I would like to thank Dr. Bhatia and the administration for having the trust and vision in this program, Dr. Rubin for his mentorship, and allowing me the opportunity to gain experience in my 3 years to be able to confidently perform my procedures. The physicians, nurses, and staff who will be responsible for the care of our patients both before and after their procedure. To my cardiac cath lab team, everyone who's around there, who have already dedicated hours of their time to make this a reality even before this day came, and for the countless hours that we will work together to help better the lives of our patients. To my family, my mom and my sister who are here to support us, and of course to my beautiful wife, who takes care of our family in my absence and never complains, no matter how late I have to work. Last but not least, thank you to God for giving us the ability to heal those in need. Thank you for all for helping us celebrate this day, and I hope we can make you all proud in the years to come. Thank you.
Thanks, Dr. Kashkarian. And of course, finally, our president of Prime Healthcare, of operations for Prime Healthcare Services, Mr. Mike Sarian, has more than 30 years of executive management experience in healthcare. Was that 40?
No, like 10.
10? Okay. Well, you know, Hilda.
Yes.
should be 10.
Just applying to the job.
Yeah, that's right. Healthcare that includes serving a multi-hospital system CEO and multi-specialty medical group CEO, hospital CFO, and other senior executive and finance positions. Our boss, Mr. Mike Sarian.
That was a wonderful introduction. Just make sure that my age never shows up. Just all kidding aside, this is a wonderful day. It's a great day for the hospital, especially when this hospital was near bankrupt, or at least that's my understanding is it wasn't a functional hospital. It was about to shut down when Prime bought it as its third hospital. So in less than 20 years, or less even, this became a very successful hospital in the Valley and LA. and serves the community. Now this is another milestone as well as a great accomplishment to add these cardiac services to the hospital and provide the best care possible for our patients and our community. Again, I want to congratulate the team at the hospital, the administration, as well as the physicians, the cardiac care team, as well as our prime leadership for providing this hospital and dedicated it. It is a nonprofit hospital, I want to emphasize that. It serves the community. It's not Prime gets any profit out of it. It's a nonprofit serving the community at large, and it's going to stay here for years to come. Thank you so much, and God bless you all.
So our Chief Executive Officer, Boki Park, couldn't be here today, but she extends her warm welcome to each and every one of you to please continue encouraging and campaigning throughout our community in San Fernando Valley that Shermanoaks Hospital and Encino Hospital Medical Center are your hospitals to go and receive top-notch care. So she just wanted to extend that message to each and every one of you. Again, Hilda.
Thank you. Before we continue with the program, I do want to apologize to one special person, a VIP that I did forget to mention, Officer Boca Negra. I do apologize. He took time from his busy schedule to be here with us today. Now, I do apologize for forgetting and misplacing your name, but remember this space. I will be on the 210, 118, and the 405. Cutting people off, trying to get here on a timely fashion, so don't give me a ticket.
No, I have great blinders.
Thank you, I appreciate that. Now, I do want to proceed with the program. If you can all proceed to the radio.
Just to find them more time. So before they could do bypass surgery, put the patient on the balloon pump, and then as for right now, we transfer to other hospital. So that's what. All right, welcome. Right on the
What? I sneak in already.
These are actually our balloons that we open up the arteries with. These are stent balloons. So when the arteries are compromised and closed, put the balloons down, that opens up the artery. The balloon doesn't stay and it comes out. Then we'll put a stent in. It kind of reminds you of the spring in a pin.
Okay.
And they're coated with drugs. They're like time released to keep the arteries open. So the stent will go in after the balloon. There's a balloon that the stent rides on. Expand that stent up against the walls of the arteries, and then it stays. And you take aspirin all the rest of your life to keep those blood flowing.
So the aspirin are actually good for you. I mean, you hear about it all the time, but
Yes. This is our assistant.
Dr. Starian, whichever one of our techs will go ahead and meet with us. Don't want to see so
Great explanation. Thank you.